North Carolina is taking new steps to help those on the front lines of the growing pandemic. From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Tuesday, April 7th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. The State Department of Health and Human Services is providing financial assistance to help essential workers afford childcare during the COVID-19 crisis. Today, DHHS announced it has established the Emergency Childcare Subsidy Program for essential workers. The program establishes a hotline parents can use to find childcare services, as well as funds to help families who cannot afford such programs. Speaking at a press conference today, DHHS Secretary Dr. Mandy Cohen said the program serves a vital need for those on the front lines of the ongoing pandemic.
It's the truck drivers who are delivering food or medical supplies, our grocery store workers who are stocking shelves, our pharmacists filling prescriptions, our janitorial workers are sanitizing essential workspaces, and of course, our healthcare workers are on the front lines taking care of those who are sick. The one thing they all have in common, if they are parents or if they're caregivers of young children, when they go to work, they need a safe place for their children where they'll be cared for and nurtured.
The program will also give financial bonuses to teachers and staff in childcare programs that serve essential workers. Financial assistance will be offered through May and may be extended. More information can be found on the North Carolina Department of Health and Human Services website. A website says North Carolina has a lot of room for improvement when it comes to practicing social distancing. Unicast Online updates its social distancing grade for each state daily by analyzing cell phone data to track movement. North Carolina currently has a D- rating. In March, the state scored a B. The lower grade is due in part to North Carolinians visiting restaurants, which Unicast considers non-essential businesses. Currently, Governor Roy Cooper's stay-at-home order allows people to order takeout from restaurants, while dining rooms have remained closed since March. According to Unicast, the North Carolina counties with the best social distancing practices are Durham, Jackson, Mecklenburg, Pitt, and Watauga, each receiving a grade of B-. On the other end of the scale, at least 43 counties in the state, including Robeson, Wayne, and Johnston, scored an F. At the time of recording, more than 3,200 people in North Carolina have tested positive for the virus, and at least 53 people have died. Currently, there are at least 132 confirmed cases of recovery from COVID-19, though that number could be higher as not all counties are reporting this information. Many nonprofit organizations are trying to stay afloat after social distancing restrictions have led to canceled or postponed events. Kathleen Ruddy, the chief executive officer of St. Baldrick's Foundation, a charity which raises money to fight childhood cancer, says St. Baldrick's, as well as many other fundraising organizations, fear that their ability to advance critical causes will fall far short of goals.
We are trying to collectively solve some of the biggest challenges before mankind today.
Ruddy says the nonprofit sector accounts for 20% of the national economy. That was before the pandemic. Now, in North Carolina alone, at least 20 planned fundraising events have been canceled, accounting for an estimated $400,000 in lost donations that would have provided the funding for research grants. Ruddy says the difficult economic environment may also make donors less likely to chip in larger sums. In response to the situation, St. Baldrick's and other organizations are turning to virtual fundraisers and asking people for smaller donations that will help keep research pipelines and other causes on track during the pandemic. Today, more Fort Bragg soldiers left for New York to support FEMA in their fight against COVID-19. New York City is considered the center of the coronavirus pandemic in the United States and needs all the help it can get. To make room in hospitals for critical patients, the Javits Convention Center in New York City has been turned into the nation's largest hospital, with at least 2,500 beds and 40 intensive care units and ventilators. More than 20 soldiers from the 44th Medical Brigade will join other Fort Bragg personnel to provide command over the Javits Hospital and other medical centers. With store shelves empty and many cleaning products like hand sanitizer and disinfecting wipes in short supply, some consumers have started making their own chemicals at home, but medical professionals warn this comes with risks. Speaking to WREL, Jeffrey Hammerstein of Wake County EMS said people attempting to make their own sanitizers and cleaning products at home need to be extremely cautious.
On the lighter side, it can just be harmful and corrosive to your hands and cause a lot of irritation to your hands. On the other side, with certain chemical mixes, you can create poison gases that are extremely dangerous to you.
Some of the most common mistakes include mixing bleach with rubbing alcohol, vinegar, or ammonia, or combining hydrogen peroxide and vinegar, all of which produce highly toxic substances. If you can't find hand sanitizer, EMS says washing your hands regularly is enough. They also warn not to believe everything you read online and to consult official sources like the CDC for more guidance. This has been your Coronavirus North Carolina News Brief for Tuesday, April 7th, 2020. Remember, if you like the information you get from this podcast, let us know by giving us a rating and review in whatever podcast app you use. And while you're there, be sure to subscribe so you don't miss our new episodes, posted daily by 5 p.m. Thanks for listening.